News 4 is once again teaming up with Roswell Park for the annual Mammothon. Let's send it back out to Allie.
Good morning to you, Scott. Yes, a gorgeous morning out here on the terrace just outside the Breast Imaging Center at Roswell Park downtown. Genetics often play a factor in whether you have breast cancer. We are learning so much, it feels like almost daily, about genetics. Joining us this morning to talk a little bit more about those risk factors, Dr. Jessica Young. Doctor, thank you so much for being with us this morning.
Thank you for having me.
What are we learning in terms of how genetics plays a factor in breast cancer?
I mean, genetics testing is getting better and better, so we're finding more and more gene mutations that might be contributing to breast cancer risk. Genetics is just a small part of breast cancer risk, though. So genetics means you have something in your DNA that might be causing you to have breast cancer, but when we talk about family history, that's different. You might have family history without having a genetic mutation, and then you might also just have personal risk factors for breast cancer as well. So a lot of different things come into play, but genetics is definitely a part of it.
Like what? What are some of those other risk factors here?
So a lot of things that are very personal to just you as a person. Doesn't matter what your family history is. Things like when you started having your period, how many children you had, when you had them, if you've had any breast biopsies before, your weight, whether you've taken hormone replacement therapy. So those are a lot of the very, small things that make up a risk that are a part of our daily lives.
You bring up an interesting point. I hadn't heard about how many children you have and when you have them, how that plays a role. Can you kind of go into that a little bit more?
Yeah, so generally speaking, if you have more children and if you have them at a younger age, it tends to be a protective effect against breast cancer. And certainly in our society these days, we tend to be having children a little bit later and having probably less children. So it's becoming a little bit more of an important point as we go on.
Absolutely. And I know that there's an important program here at Roswell that helps with genetic testing. Talk to me about that and how I might find out if I'm eligible for the program.
Sure. So we have a high-risk breast cancer prevention program, and that really allows women who are at risk because of family history, or they have a gene mutation, or they have other just personal risk factors to come in, and we can assess whether you're eligible for genetic testing. That depends a little bit on your family history. Or whether you're just eligible for enhanced screening, including doing MRIs in addition to mammograms. So people can just come in and apply, and sometimes the good news is that you're really not at high risk, which is great, and sometimes it's that you're at higher risk, and what can we do to help you reduce your risk with that?
Dr. Young, we know you're busy. You have a patient waiting right now, so we'll let you get back to it, but we appreciate your time and explaining kind of how it works and your role here at Roswell. Thank you so much.
You're very welcome. Thank you.
Mammograms, of course, are also a preventative measure. We're encouraging 550 women to schedule your mammogram before week's end. That is the goal here as we wrap for the morning for the Mammothon. But Jackie Walker will be live this evening through our evening newscast, talking to more experts and hearing that personal testimony about why mammograms are so important. Scott, we'll send it back to you.